Perales, and I'll be talking about antidepressants prescription drug. What are antidepressants? Antidepressants increase neurotransmitters, which are chemicals in the brain such as serotonin, dopamine, GABA, and norepinephrine. People who struggle with clinical depression, generalized anxiety disorder, or obsessive compulsive disorder can be treated with antidepressants. Other mental health conditions antidepressants can help is panic disorders and PTSD. The chemicals in antidepressants affect users in different ways and don't always work. This is why there are more than one type of antidepressant available. Some type of antidepressants are SSRIs, SNRIs, and atypical antidepressants. Selective serotonin reuptake inhibitors are Prozac, Zoloft, and Lexapro. For SNRIs, it can be venlafaxine, duloxetine, and venlafaxine. Atypical antidepressants don't usually fit in their own category. Some examples are bupropion, trazodone, and mirtazapine. There are more than 3 different types of antidepressants, but these are the ones I will be focusing on. Also, antidepressants are a Schedule IV drug, which means there is a low potential for abuse and dependency. Antidepressants are usually taken orally. How SSRIs, SNRIs, and atypical antidepressants work. SSRIs work by blocking inhibiting reuptake, which allows more serotonin to pass messages between nearby nerve cells. Serotonin is a neurotransmitter and it has good outcomes like improving mood, emotion, and sleep. SNRIs block the reuptake of the neurotransmitter serotonin and norepinephrine in the brain. They both increase serotonin and norepinephrine. Atypical antidepressants ease depression by affecting neurotransmitters to communicate between brain cells. They change the levels of more than one neurotransmitter. Some examples are dopamine, serotonin, and norepinephrine. Here's an image of how SSRIs work. Like mentioned before, selective serotonin reuptake inhibitors, SSRIs, medication works by altering and increasing the balance of serotonin levels in the brain. There's a link below where you can click for more information. Effects on the brain and body. Some mental effects can be suicidal feelings, feeling like self-harming, hypomania or mania, increased depression, confusion, and hallucination. Some physical effects can be weight loss or weight gain, fatigue, drowsiness, dry mouth, nausea, headache, constipation, agitation, reduced sex drive, erectile dysfunction, and serotonin syndrome. Some reported side effects of long-term antidepressant use are feeling emotionally numb, feeling dependent on the medication, sexual problems, weight gain, reduced positive feelings. The less severe symptoms usually only last within the first week of taking antidepressants because your body's getting used to the medication. This is why many psychiatrists encourage those who take antidepressants to wait a few weeks before deciding whether to continue the medication or change to a different antidepressant or also change the dosage. Risk and consequences. Antidepressants are not considered addictive, but stopping treatment abruptly can cause withdrawal-like symptoms. Some symptoms can be uneasiness, nausea, dizziness, lethargy, and flu-like symptoms. Also, combining alcohol with antidepressant impairs judgment and thinking, which can be dangerous. When alcohol is mixed with antidepressants, these effects can amplify, meaning you can become more intoxicated more quickly. And if poor decisions are made while mixing these two substances, the effects might be dangerous. Some risks you might have if you mix alcohol and antidepressants are increased depression symptoms, increased side effects of medication. It can be fatal and it can increase drowsiness. Facts about antidepressants. Doctors can help with antidepressant side effects. Antidepressants are not just for depression, they can also help, like mentioned before, for PTSD, panic disorders, and much more. It takes about 4 to 6 weeks to reach full effectiveness, and you don't necessarily have to stop taking your antidepressants if you are pregnant or breastfeeding. Here are some references, and that concludes my presentation. Thank you.